Hello, I'm Robert, fact checker and science blogger, and helping people who are scared of COVID-19, amongst other things, for our Facebook group Doomsday Debunked. This time, I'm going to talk about something that puzzles lots of people who use these dashboards to find out about COVID-19. And they look, for instance, if you look at the total cases in the world, they say 16,000 deaths and only 100,000 recovered. And they say that's much higher than the 1 or 2% that they talk about as being what it should be. So what's going on? Is it getting worse? And so I'll explain what's going on in a minute. And then we take another example. Take, for instance, Italy. And now we look, 6,000 deaths and only 7,000 recovered. And again, that just seems really, really bad. It's not. I'm going to explain why it's not. Now go and look at the United States. Now, you see 533 people have died and nobody has recovered. So I'm getting very scared people from the United States saying, look, everyone in the United States is dying. Now, what they're missing is the total confirmed over here. And most of these are recovering. So you want to look at the recovered and the recovering. And so, to explain a bit here, I'm just going to look at New York State. New York City, whatever it is, the 15,000 cases they've now got. It's now gone up over to 20,000. And so this all started just a few days back. This disease increases very rapidly, but part of this is also there's an awful lot of case finding going on. So they're doing more testing in New York City than anywhere else. And they're really discovering them. Now, don't be alarmed by large numbers. This means that 20,000 people have been contained and quarantined, and all their contacts are being or have been contained as well. And so, but this is to explain why none of them have died yet. So before that, there were very few. If you go back to this 23rd, go back to, it usually takes a couple of weeks to die. That's the 10th. And the maximum of 10, I think they can have them in 10 days. So they had 328 cases back then. 143, 77. So, but remember, 80% are eventually going to recover, but some of those have died. So if you look at the deaths, then some of those from back then would have died by then, and some of those back then would have died by then. But if you look at the recoveries, then recoveries take a very long time. So to recover from COVID-19, they mean recovered and discharged in that figure. That doesn't mean just you're feeling better. That recovered means you've been discharged. And the thing is that even if you have the mild version of the disease, then you would have it for maybe a week, unless you've got a very, very mild version, and then you remain infectious for another 2 weeks. So you're not going to have any recovered for probably 3 weeks after it started. So if you go to 23rd, then you've got to go right back to before. There's only one back then, on March the 2nd. So, and so if that was a very mild case, and they could have recovered by then. Clearly, the very few ones from back then, and none of them were mild enough to have completely recovered by now. So you get some very mild cases. Most are reasonably mild, but they would last them for a week or so, and maybe longer. So those are recovering. So if you had it back then by then you'd be feeling better. And certainly by 2 weeks you'd be feeling an awful lot better. Even by a week after, by the 9th you'd be feeling much better. In fact, you wouldn't think you have any disease at all. But you can't have recovered until you get to another couple of weeks after that. So it's no surprise that we've got no recovereds. But we'll have lots of recovering, and we'll have an awful lot of those 42,000 in the United States will be completely symptom-free. and feel completely well, but they're just waiting for an extra 2 weeks, or 2 days, 2 tests, 24 hours apart, that are test negative if they test them thoroughly, and they're just waiting for that to happen, and that's all they're doing. So there are thousands and thousands of people in the United States who are being quarantined or isolated at home, and they're just waiting for to have these 2 days with it being negative, so they can leave their house and go about without infecting anyone. So that's all that's happening there. And then some of them will be in there for a very long time. So these ones have died. Some of them will, so now these 15,000, and there won't be many recoveries for a long time. So if you go back to the 18th, the 2,000, so those 2,000, they're likely to recover sometime in April. And then these 15,000, they're going to recover well into April. So you have 20,000, most of those are going to recover, but they won't recover until well into April. And because they'll be completely well, maybe some of them will keep you well within a few days and some within a week, but they won't count as recovered and discharged until well into April. And then many of the ones who nearly died, and then they get out of it, and they could be under a ventilator for 6 weeks. And at the end of that 6 weeks, then they've got that extra 2 weeks probably after that. And then they would count as recovered. But for those who've been really sick for a long time, then they get over the virus, but their body needs to heal after that, because their lungs are quite damaged. And some of them have gone all the way. They might have just been saved from the brink of multi-organ failure. They're all going to recover eventually. There's some question about whether they'll totally recover their lung capacity, but most of the doctors seem to think they will, and with swimming and things like that. But if you're talking about really totally recovered, so they're just totally back to normal, then they won't be recovered until the summer. They're totally back, so they'll be feeling a bit breathless if they have to run or something, and for a few months after that. So that depends on how they count them as recovered. And I think they would count them as recovered as being discharged. So they'd be discharged from hospital when they are well enough to walk around and look after themselves, and when they have also no longer shedding any virus. But their body is damaged, so they will still have several months more before those really bad cases are back to normal again. So I hope all this helps you to understand these figures a bit better. And so don't pay any attention to that. And really another factor is that countries that find lots of cases are good. So if we now look at South Korea's one is nearly over, and some of them will still die because they can take quite a long time to die. You can be weeks under a ventilator. But this gives a much better idea of the percentages, because South Korea did much more aggressive testing of everyone, and they got total confirmed 8,961 and only 111 deaths. And so that's much more difficult. And then if I can see if I can find Singapore, that's been way down there. Now Singapore, yes, there's Singapore. It's the same population as Scotland, but they were very prompt to act. Lots of Singaporeans from China. It's got a lot of ethnic Chinese people in it, and Chinese culture. So they were very much in touch with what is happening in China. They are very high tech. They very quickly brought in, immediately on the 28th, so not long after the Wuhan lockdown, they brought in testing for COVID-19 over the entire country, of 5 million people the size of Scotland, so they could detect anyone immediately within a few days. If you went in to your doctor any time after the 28th in Singapore and said, "Oh, I've got a bit of a fever," he would then test you for COVID-19. Or he'd just do a swab which would go off and automatically be tested along with all the other viruses. So Singapore gives us our very best data that we've got. And it's only had 2 deaths out of the 509 confirmed, which is that's 4 per thousand. So Singapore is running at 0.4%. Now, it probably is a little bit more than that because some of them will still need to die, are still going to die, but probably not very many. If you look at the active cases for Singapore, let's say how many are active for Singapore. These are the only ones that are left to, let's see if I can find Singapore. There we are. No, that's Malaysia, sorry. Where's Singapore? There's Singapore. Existing 355. Yes, so it has got quite a few. 152. I should have just taken the difference. I'm being silly. Anyway, so they've got 2 deaths. They've got these 355 existing, but about 80% of those, or 80% of the 509, which is about 400, then will be mild cases. Some of those are recovered, and so most of those existing, they're going to be mild cases, and then there'll be a few that are still left on the ventilators. Number of deaths is going to be going up for sure, but you can see that it's really quite small, and this is because so it's not just because they've got good healthcare and everything like that. It's because they've detected all the mild cases. Even if you've got the mildest case in Singapore, apart from possibly some children maybe totally asymptomatic, and then they don't infect anyone, so you don't worry about those. And at this stage, there's academic interest. Anyone who's asymptomatic and doesn't infect anyone. But anyone who gets a bit of a fever and a cold, then they're found. A bit of a fever and cough, or difficulty breathing, then they're going to find them in Singapore, as long as they go into their doctor or their clinic. So we have very good data there. And so that's it, because you have lots of the mild cases being detected. In the Europe, then Germany is noted for having lots of, it's got 29,000 cases, but that's partly because it's detecting lots of the mild ones. And it also has quite a small number of deaths, mainly because of the very high number of confirmed cases that it's detecting. And it's early in its epidemic, and of course many more are going to die, but those are more accurate figures. So anyway, so I hope this is all much clearer, and as to how this all works. And really, you can't work out the case fatality rate by looking at these figures. You've got to go by the academic papers, and they have methods of working it out. And they go and look at the detail behind the scenes in much more detail. They have access to more detailed figures. The ones in China, they've actually got the patient's records, and they can use them, which they of course can't reveal to anyone else. And then they work out the case fatality rate. And it's believed that, and for instance, with the first 1,000 cases in Italy, then that gives a reasonable idea, because that's a fair while back now. And so there's things like, so we've got early cases in Italy, got early cases in China, but late enough, so they've got the latest ways of treating them. And so the ones outside of Wuhan, early cases in China outside Wuhan would be the best, because they've got they have better treatment by then. So anyway, and the case fatality rate seems to be around 1%. Some say 0.7%. 7 out of 1,000 will die, and everyone else recovers. But it's much higher for elderly people, and if you're over 90, then as many as 200 out of 1,000 elderly people over 90, and especially if you've got diabetes or something, heart troubles and so on, that also increases your risk. But if you're young and you've got those, then you've got a big advantage from being young. So, but most people recover from this. Nevertheless, it is a severe disease. You don't want to get it, and you need to protect yourself. And I've talked before about how to protect yourself. So at some point I'll give another video about that. But I just wanted to reassure you about this. And I've got an article about it here, but these it talks about it. Oh yes, and I've got some videos here. Go and have a look at these videos. This is a very mild case, and she never really felt unwell. This is a couple of more severe cases, and so you could have a listen to those two, and it shows that people do recover. So again, other people ask me is why don't we have these stories about people who've recovered? And the reason is patient confidentiality and stigma. And so if someone's recovered from COVID-19, then ignorant people will kind of want to keep a distance from them and think, oh, that person got COVID-19, I might get sick or something. So you get people who are reluctant to say that they've recovered from COVID-19 and come out on TV or whatever. But if they've recovered and they've got over it and they've been shown that they're no longer shedding the virus, then they're fine. So they're still being monitored. They should be being monitored in case there's a resurgence, but there hasn't been any evidence yet that the virus can start up again in a patient who's already had it and got and recovered. So, well, there's one case. That is one case where it seems to have happened. It seems to be quite rare. That is the concern. People are still monitoring this, but it's not happened. I mean, in China, they're just not. It seems to be very, very rare that happens. There's one case where possibly it's happened, and quite soon after they were thought to have recovered, and they seem to have a bit of relapse and still have the virus there. That's very rare. So anyway, that's that. I hope this helps you all have a better idea about what's going on here, and not just you are not a trained epidemiologist. I'm not a trained epidemiologist, and it really takes expert. It's an expert job to try and work out what the case fatality rate is, and even then, even the best experts, they can't estimate it properly at the beginning of a pandemic, or even this far in. They're still struggling to find out. They need to do these serology tests, which is testing the blood serum throughout the and they developed it very quickly within weeks, months. They've got to start now. They've already started doing that in China. Then they will have the proper case fatality rate from that, and from very detailed look at who died and so on as well. It's going to take some weeks before we really have a proper handle, and sometime in April then we may have a good idea of what the true case fatality rate is. And you can't expect better than that. It's a brand new disease, and you see, the thing is, you can't model a human body. It's far too complex. So you get people kind of thinking, oh, if we should just put a human body into a computer and put the virus into a computer, interact the virus with the human body and see what it does to them, and see what the human body is going to do, months down. It just doesn't work like that. Our science is not even remotely close to being able to do anything like that. It's experimental. We have to do the data. We have to, and it's unethical, of course, to give people the virus, and you won't get the same results from animals, obviously. So the only way is to find out from the experimental data as the outbreak progresses, and what you discover during the outbreak about what this virus actually does do to people, from people who get it, even while you're doing your very best all the time to stop them getting it. So you're constantly fighting it, stopping people from getting it, at the same time looking at the data you've got during your attempt to fight it, to try and learn about this disease in ways that are totally unethical to do, because you could never do an experiment, give 1,000 school children COVID-19 and see if any of them die, or give 1,000 malnourished. So the WHO are very concerned about whether it would have an effect on malnourished children in refugee camps. And there's literally no way to know until we get an outbreak of COVID-19 amongst malnourished children. There's no way to know. You can't predict it. And they're also very concerned about the effect of COVID-19 on Sub-Saharan Africa, where many people have AIDS. And again, they can't really tell what that's going to do combined with the other situation there. And can't. So this is just, don't expect too much from the scientists, because they're not miracle workers. They're not like Spock on Star Trek, and they haven't got little book or the things that you can hum it over a body or whatever that thing is. The what's it called? The thing they put over a body in Star Trek. They just immediately diagnose where all the viruses are and what they're doing and what they're going to do, and that is science fiction. I don't think we're ever going to have that. And certainly we're nowhere near that. Anyway, hope this helps. And, oh yes, if you do join our Facebook group, Doomsday Debunked, then please check the rules at the top of the group. This is very important to make it function properly. So, anyway, that's a kind of reasonably, sort of quite cheerful. Now I've got to go on to this Boris Johnson thing. I wish I didn't have to, but I have to. Absolutely have to. So, we'll see how that goes.